This show is for educational and informational purposes only. It is not to be used for diagnosis, evaluation, prevention, or treatment, which requires your medical team. Why does the diabetic foot have problems? The diabetic foot has problems most frequently due to nerve damage, which is called neuropathy, circulation problems such as peripheral artery disease, foot deformities such as hammer toes and bunions, injuring your foot from pressure or wounding your foot from damaging it. These are some of the most frequent causes of foot problems in the diabetic. The diabetic foot is the number one reason diabetics are admitted to the hospital. The diabetic foot incurs tremendous financial burdens of enormous expense and the misery of potential and realized amputations. Diabetic amputations don't just happen. There is a common pathway. First, one becomes diabetic. Then the person with diabetes loses feeling in the feet, and a wound opens up. Poor blood supply makes healing the ulcer more difficult. Then, with the immune system not working well, infection occurs. Sometimes the only way to stop the infection is to amputate. What happens to the foot when you have diabetes? The diabetic foot develops nerve damage. The feeling in the foot is less and you can't protect yourself due to the loss of that feeling. Circulation problems become more, and there are changes in the foot causes hammering and clawing of the toes. You can start wasting the muscles of the foot, and you can walk on the bones of the foot. Joint stiffness, skin and nail changes, open wounds in the foot that are hard to heal. We will look at these reasons and others more closely in the following slides. Diabetic neuropathy is the nerve damage caused by diabetes. Diabetic neuropathy usually starts in the long nerves of the body, the ones that go all the way down to your feet. Those almost like die back. And that dying back we call a foot or glove distribution, meaning it comes on like putting on a sock or putting on a glove. Usually it starts in the foot, and then as it goes up the leg, sometimes when it gets to the knee, the hands start becoming involved. This nerve damage usually is seen as a loss of feeling. You can have pain and loss of feeling at the same time. Peripheral neuropathy, or peripheral nerve damage, means that the periphery of the body is affected, and that periphery is the outside of the center of the body, such as your arms and your legs. Diabetic peripheral neuropathy is common among diabetics. Peripheral neuropathy shows up in the feet and legs of the diabetic first. This nerve damage causes a loss of feeling in the feet. With a loss of feeling, it is harder to protect your feet. Imagine getting up at night and kicking the bedpost and not feeling it. You could scrape, bruise, or break a toe. Diabetic peripheral neuropathy, it leads to numbness and sometimes pain and weakness in the feet and legs. People with diabetes can develop nerve problems at any time, but the longer a person has diabetes, the greater the risk. Peripheral neuropathy is more common in people who have had problems controlling their blood glucose levels. Some people with diabetic peripheral neuropathy have no symptoms at all. For others, the first sign is numbness, tingling, or pain in the feet. A person can have both pain and numbness. Symptoms are usually minor at first, since nerve damage occurs over several years. You might not notice a mild case for a long time. Symptoms of peripheral neuropathy may include numbness or not reacting to pain or temperature. It can be a tingling, burning, or pricking feeling, pins and needles. So what does all this mean to you if you have peripheral neuropathy? Well, the first thing you have to know is, have you lost protective sensation? That is when you cannot feel the little nylon wire your provider uses to test your feet. Loss of protective sensation means you have lost the ability to protect your feet from pain or injury. For example, you will not feel a torn lining or a seam in the shoe, or maybe even a small rock. Something that seems small may hurt you. Pain and feeling are an alarm system for your injury. They protect you because you limit your activity when you feel pain. However, as neuropathy progresses, you lose all feeling. You are not aware of the pain. Then with your guard down, you may injure your foot or your feet. Pain protects you from causing further injury. When you have lost that sense of pain or injury, then injury to your foot continues. With pain and feeling gone, you may not detect problems early enough to prevent further injury. Immediate knowledge of an injury is vital to healing it. If an injury is present, each step you take on that injury causes further injury. Imagine a rock in your shoe that you can't feel but continue to walk on it. You could wear a hole in your foot. Why is this dangerous? Normal use of your feet when you have lost feeling in them may cause injury. You may not feel the discomfort of a poorly fitting shoe. Poorly fitting shoes are involved in up to half of the problems that lead to amputations. Here are some of the problems that can develop when you lose feeling in your feet. You may buy shoes too small in order to have them feel like they used to feel. You may not change the way you walk if you develop a sore spot. Changing the way you walk is a way to protect your feet when you feel pressures or soreness. You may develop a red spot, hot spot, blister, or sore and not be aware of it. You may break a bone and not feel it. You may collapse the foot, known as Charcot foot. You might also stop good habits such as rotating and checking therapeutic shoes and socks frequently because of the lack of feeling. With diabetes, you can have peripheral artery disease. Peripheral artery disease is a narrowing of the arteries that reduces blood flow to the feet. Blood flow brings oxygen and nutrition and takes away the toxic chemicals from your foot and leg. It's vital to healthy cells. Peripheral artery disease is more common in diabetics and in obese patients. So type 2 diabetes has a lot of problems with peripheral artery disease. You won't be able to heal a sore or wound. So if you get an ulcer, it's hard to heal. High blood sugar causes the arteries to narrow, and when they narrow, blood pressure goes up, and you can lay down fatty deposits in the arteries, and they can form blockages to the blood flow. The small muscles of your feet may waste away, changing your foot. This increases pressure on the foot. In addition, it can cause high arches, claw toes, and changes in the way you walk. Diabetes can cause you to have a high arch. It can cause heel pain, claw toes, walking on the bones of the feet, corns, calluses, and ankle sprains. Severe obesity can cause you to have flat feet. You can have arthritis of the knees, heel pain, hammer toes, bunions, corns and calluses, ingrown toenails, etc. The difficulties with these problems are that with the diabetes, they can cause you to ulcerate, and ulcerations can get infected and then may lead to amputations. Diabetes affects your abilities to fight infections. We know the circulation can be poor, so you may even have problems getting the materials of your body to the site of the infection to fight it. Your body does not fight off infection as well as it should. Infections may be worse. Many factors the high glucose affects that affects the immune system or the body's defense system to fight off infection. Diabetes affects your ability to move. Blood sugar gets into your tendons, ligaments, and joint capsules, so you can't move your joints as well. It changes how your bones connect. This changes the shape of your foot, and pressures increase. Diabetes affects the skin of your feet. Your skin may dry out. The skin barrier begins to break down. You may get calluses and cracks in the skin from pressures. One of the things that make the foot unique is that you're standing and walking on it. Diabetes makes your skin more sensitive to the pressures produced by the weight of your own body. Here we see a pressure diagram. The dark areas are increased pressures. Pressures are increased on the bottom of the diabetic foot, and high barefoot pressures can cause an ulcer. Here is a summary of some of the things that can go wrong with the diabetic foot. It can affect the nerves, the blood vessels, infections, the skin, the muscles, loss of movement, and pressures. The problems of the diabetic foot may cause you to lose some of your senses. It may cause you not to notice danger. It may cause you not to prevent an injury. It may cause you to injure without knowing it. It may affect the body's ability to repair itself. Here's what you need to know about neuropathy. Number one, you may not detect problems early enough to prevent unwanted complications. What that means is that you can injure yourself and have it get worse before you even know it. 2, you may not feel damaging hot and cold. 3, you may not feel the pain of an injury. 4, with the loss of feeling, protective sensation, you may further your injury without knowing it. 5, you may break a bone and not know it. 6, you may collapse the foot, known as Charcot foot, before you know it. 7, you may buy shoes too small in order for them to feel like they used to feel. 8, changes in activities may cause injuries. The diabetic foot continues from a healthy foot to an unhealthy foot that is very fragile. Your doctor can tell how unhealthy your feet are by putting them in a category. The categories tell how much you are at risk for an ulcer or amputation. A simple way to remember the categories are: Category 0, you have corns or calluses, which may lead to ulcers. Category 1, you have nerve damage or loss of protective sensation, so you can injure your foot and not know it. Category 2, you have circulation problems, which means you may not be able to heal the injuries of Category 1. Category 3, you have had an ulcer or an amputation. This is important because you are at high risk for ulcerating again, and because you have to have proof that your diabetic shoes and orthotics are pressure relieving. The higher the category, the more serious the problem is and the more unhealthy your feet are. The thing you can do for type 2 diabetes is to put it behind you by reducing your blood sugar, that is, losing the weight. You may be addicted to food. Sugar and flour are highly addictive to some people. Get help for your food addiction. Remember, you can't outrun a fork. That means that diet is more important than exercise in losing weight. I believe most type 2 diabetics have some sort of food addiction. Food addiction is a disease of the body, mind, and spirit. If medicine, psychology, and religion haven't helped you with your food addiction, go to the addiction community for help. That is the 12-step programs. There is no minor injury to the diabetic foot. Report any injury to your medical team. It is best to let them decide how to treat it. And remember, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Joe.